Chief Innovation Officer at Boston Children's Hospital, and also our ABC News medical contributor, Dr. John Brownstein. So, John, let's start off with what we're just learning. Previously, when we got our vaccine, we had to wait 6 months to get the booster. Now we're just now learning that we only have to wait 5 months. How significant is this?
You know, I think this is somewhat minor. That change already happened for Pfizer. You have to wait now 5 months to get that booster. And now the FDA is authorizing Moderna to go alongside. So it's going to make them essentially equivalent in terms of timeframes to get to that booster. I think the issue is really, you know, there's a concern about reducing immunity, waning immunity. And so just shortening that interval just gets people up to that immunity that, you know, we all want to get to, especially as, you know, this pandemic is raging on right now.
All right, well, we also mentioned this new study showing that severe illness is extremely rare in fully vaccinated adults. That's new this morning as well. What can you tell us about that?
You know, this is really exciting data. And I think, you know, it reaffirms what we already know. These 3 vaccines are providing incredible protection against what matters, severe illness and death. And this was done during the time that Alpha and the Delta variants were dominant, so more severe variants, in fact. And what's really exciting is that protection really is stable over time. And so none of these vaccines saw really any major waning immunity. Pfizer and Moderna, a slight amount of waning, but they had further to fall because they provided excellent protection. I think the data supports the current CDC guidance around boosters. So if you had that J&J vaccine, get that booster after 2 months. Pfizer, Moderna, as we just talked about, now it's 5 months, get that booster. These vaccines are working incredibly well.
But at the same time, John, and this is what my family is trying to figure out, and a lot of our friends, you know, we're vaccinated, we've had the booster, but now after the holidays where everybody has gathered, we are finding out that more and more people have had breakthrough infections. So is that Omicron? Because these are all folks that were vaccinated, boosted, and now they're finding out that they have COVID. And I'm talking about friends of ours that are adults and kids.
Same. I mean, I was getting text messages, you know, all day, every day throughout the holidays. And this week, you know, there's exposures, there's breakthrough infections. Luckily, the vast majority of these breakthrough infections are mild or even asymptomatic. You know, we have testing, there's identification of illness. You know, we get potentially exposed, and then we identify a mild illness as being a COVID, and it's likely Omicron. Omicron is dominating well beyond 90% of all infections. We still do have some Delta around. But I think, you know, again, this tells us these vaccines are working. Yes, you might get a mild asymptomatic disease, but the far, you know, greater number of people that are unvaccinated are the ones that are dealing with the severe illness and death. And that's why it's just still so important. If you haven't gone that first or second shot, you know, that's more important than pretty much anything.
So in many ways, it seems like we're going backwards, too, because, for example, here, you know, within even our company, it's like we've gone back to the very beginning with the social distancing and the masks and not being able to be in the same room together. Like, it's pretty hardcore again. We're testing every single day. Is that necessary? Do we need to do that, step that far back as we move forward?
You know, it's a good question, and I get those comments a lot. You know, we know so much more about this virus. We also know that Omicron is less severe, but you know, we're in a moment where we have never seen this many cases on a daily basis, and we do not know what the impact of our health this will be on our health systems. We already know that EDs are flooded across the country. We do see upticks in hospitalization. So I think for the very short term, as we're dealing with this surge, being able to have these layers of interventions, masking, testing, are important. I think we know more than we did back then. We're not obviously going back to lockdowns. We should not be closing our schools. We should be doing the things that we know that can limit transmission, that prevent our hospitals from being impacted. But beyond that, I think we're getting to a place where I think we're eventually going to be starting to live with this virus as opposed to trying to stomp it out and eliminate it, which I think for most of my colleagues, we recognize that that's just not going to happen.
Right. That's what we've been talking about as well. So what is the best kind of testing to do, especially, you know, to know if you're still contagious?
You know, I think that the rapid tests are still the best measure because they're direct measure of how much virus you're being sampled from. So a rapid test tells you how likely you're contagious, and I think is a good indication of, say, if you are infected, if you get to that 5-day mark, you can take a rapid test and hopefully take one over a couple days. And if you're negative, I think that's a good indication that you can get out of isolation. Though, of course, you should wear a mask and avoid large indoor gatherings. But I think the rapid test is our best friend. I think, of course, PCR still remains a gold standard, but if we're trying to get to a point where people can start to live again, that quick rapid test before you gather, before you travel, I think it's a great tool, and it's a low bar as long as you can access them, and that's the challenge. And hopefully, we'll see a huge amount of flow of these rapid tests come as the U.S. government makes them available in the coming weeks.
All right. Well, Omicron, as you know, as we've been talking about all week, is taking a toll on schools now across the country. In Chicago, we're learning there's actually a standoff between the teachers union now and the school district over COVID safety measures, putting 340,000 students now out of class. And as you can imagine, parents are very frustrated. And earlier this week in Boston, more than 1,000 teachers and staff were out, a lot of them because of COVID. So is in-person learning a good idea right now, or should we feel comfortable sending our kids back to school?
Kira, I believe that our kids need to be in school. That is more important than anything, especially as we're learning more about this virus, especially as we know it's less severe in kids. My kids are in school in Boston. I've been trying to help our school figure this out. The main issue, of course, is just testing and getting access to tests and make sure we identify kids that are potentially exposed and they're staying at home. And also just the stress that is on teachers right now. It's significant. Many teachers are out of work because of being infected. And so just dealing with the logistics are really the challenge. But beyond that, we have the tools: masking, social distancing. We know what we need to do, and good ventilation. We know what we need to do to keep our kids in classrooms right now.
I'm with you. I want my kids in school. I really do.
Same.
Dr. John Brownstein, yes. Thank you so much. Appreciate you, John.
Thanks, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.